Hey everyone, welcome back to all my listeners. This is episode 5 in season 15. Today is Wednesday, June 4th, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, it's a brand new month of June. Summer is just a few short weeks away. My birthday rolls in as well. I hope you guys are excited for what the month has in store for you, too. All right, so in today's Newsworthy, I'm going to be featuring my spotlight on the Awareness Month of cataracts. So June is Cataract Awareness Month. And in my Trusty tip, I'm going to be focusing on what auditors want to see when it comes to cataract surgery documentation. And of course, I'm going to go ahead and close out and round out today's episode with a remarkable quote on hopes and aspirations by Langston Hughes. All right, you guys, let's get into it. So in today's Newsworthy, I'm going to be focusing on June as Cataract Awareness Month. The spotlight is on cataracts. Did you know that cataracts are the leading cause of vision loss worldwide? A cataract is a clouding of the eye's lens, which blocks or changes the passage of light into the eye. The lens of the eye is located behind the pupil and the colored iris and is normally transparent. Vision may become blurry or dim because the cataract stops light from properly passing through to the retina. Generally, a cataract does not cause pain, redness, or tears. Risk factors for cataracts include older age, intense heat or long-term exposure to UV rays from the sun, certain diseases such as diabetes, inflammation in the eye, hereditary influences, events before birth, such as German measles in the mother, long-term steroid use, eye injuries, eye diseases, and smoking. Now, most cataract cases in the United States are in older adults, but children may also develop pediatric cataracts. According to the American Academy of Ophthalmology, cataracts in a child can be congenital, which means present at birth, or acquired, which means they are developed after birth. Without treatment, cataracts in young children can cause poor development of the visual pathway between the brain and the eye, leading to vision impairment. Therefore, diagnosing and treating cataracts early in children is critical to promoting normal vision development. Now, according to Prevent Blindness, cataract surgery is one of the most common operations in the United States. During cataract surgery, an eye surgeon removes the eye's cloudy natural lens and replaces it with an artificial lens, also called an intraocular lens, an IOL. Prevent Blindness also states that, quote, cataract surgery has restored vision to millions of people. Every year in the U.S., more than 2 million cataract surgeries are performed. The key to preventing vision loss is regular eye exams. If you are aged 65 years or older, you should get a complete eye exam every 1 or 2 years, even if you have no problem seeing well. Be sure to ask your eye doctor for a dilated eye exam. Every year in the U.S., more than 2 million cataract surgeries are performed. Cataract surgeries are performed without complication in over 95% of cases, end quote. And now it's time for my best practice tips in Trusty Tip. So, speaking of cataract surgeries, they have been in the hot seat for a number of years now when it comes to payer audits. The Centers for Medicare and Medicaid Services, the CMS, has issued TPE audits or targeted probe and educate audits on cataract surgeries based on audit failures for coding and documentation deficiencies. Now, there are various MACs or Medicare administrative contractors that have various checklists or tools that you should be reviewing before you send claims out to the various MACs. For example, Palmetto GBA has a fantastic cataract surgery checklist that I wanted to focus on today. Now, Palmetto GBA considers lens extraction medically necessary and covered when one or more of these conditions exist. Now, when I'm auditing, these types of things have to be included in documentation for the service to be fully supported. There has to be an initial history and physical or diagnosis related to the treatment. The documentation has to be signed by the physician or the qualified healthcare provider. There have to be diagnostic test results or reports, including a comprehensive ophthalmologic examination and biometry results. There must be a physician's signed intent or intent to order for the procedure, and all services billed with an itemized statement of charges. Those are things that I frequently do not see, or they're not sent in. Someone has not printed that particular section out from the EMR. So I implore the staff who is in charge of printing these things out from the EMR, make sure you find these items that are tucked away in various tabs in the EMR system. Moving on, Palmetto GBA also wants to see documentation of functional impairments, activity limitations, and or participation restrictions related to activities of daily living, occupational or vocational expectations. All of that has to be found in documentation. Documentation that reflects cataracts as the primary cause of decreased visual acuity and or functional impairment. Documentation that other disease processes have been considered and ruled out as a cause for decreased visual acuity and or functional impairment. Documentation indicating the risks, benefits, and alternatives of surgery and expectations of significant improvement have been discussed with the patient. That's a big one when it comes to any surgical procedure. There has to be some sort of a statement there that the provider is discussing with the patient all of the various risks and harms that may come from the surgical procedure, as well as the benefits that can be the outcome. All of that has to be agreed to as well. Consent has to be provided by the patient. Now, documentation of the beneficiary's desire for the surgical correction also has to be found somewhere in documentation for Palmetto GBA. Now, the operative report has to be signed by the performing physician or provider. Now, that's one that can easily be corrected, but again, that op report has to be signed and dated by the performing physician or qualified healthcare provider. There's also other relevant documentation to support medical necessity. All of that needs to be submitted if you're ever in an audit situation, in particular here from the Palmetto GBA region. Now, specifically, I'm talking about HCPCS code 66984, and that is defined as extracapsular cataract removal with insertion of intraocular lens prosthesis. It's a one-stage procedure, manual or mechanical technique, which means irrigation and aspiration of phacoemulsification without endoscopic cyclophotocoagulation. That's the full definition that you see in your CPT code books. Now, there's also going to be a modifier that you need, right, to help signify which eye. Again, the payers want to know for safety of the patient and quality of the surgery performed, which eye is it going to be on? So you need to append that modifier LT for the left eye or RT for the right eye, as well as if it is a bilateral procedure. In many cases, this will not be. You will go in for the one eye first, and then you'll come back several weeks, if not months later, for the second eye once that cataract is ripe or ready to be extracted. Now, elective cataract surgery for refractive benefits to decrease the need for glasses will be denied. Again, I'm only talking about Palmetto GBA specifically, so make sure you are looking at your MACs as well for that type of statement for elective cataract surgeries. For the refractive benefits to decrease the need for glasses will be denied. So again, just because it's for a cosmetic purpose, you don't want the eyeglasses, it will be denied. Now, this does not meet the medical necessity and is not covered by Medicare. Now, specifically, again, for the Palmetto GBA region. And again, I implore you that there has to be an intent or the order has to be signed on or before the date of service. So somewhere in documentation, an auditor has to find that qualifying intent to order or the signed order itself. on or before the date of service. Now, documentation for cataract surgery must support these following elements. Let's go over this again. The operative report that includes, again, each and every page should include the beneficiary's name, the physician or the provider's name, the physician or the provider's signature. It can be handwritten or electronic, the date of the procedure. This is a big one. Also, again, that correct eyeball. Is it the left eyeball or the right eyeball? And the modifiers have to match, right? It has to match what you are billing out, and it has to match what's in documentation. We can't have a major error like that if the surgery is performed on the wrong eye. There also has to be a comprehensive ophthalmologic exam, biometry, or other supporting documentation, such as that Snellen visual acuity test or glare testing. Now, there has to be a statement indicating that the beneficiary desires the surgical cataract correction. There also needs to be a statement that indicates that the risks, the benefits, the alternatives, and expectations of improvement in visual acuity have been explained to the patient. And again, the patient has to consent to all of those terms. So they understood that, and they heard and they received what they were being told by their physician. Now, the documentation of medical necessity, documentation of functional impairments, activity limitations, and/or participation restrictions related to activities of daily living, occupational or vocational expectations. There must be documentation that reflects the cataracts as the primary cause of the decreased visual acuity and/or functional impairment. There has to be documentation that other disease processes have been considered and ruled out as a cause for the decreased visual acuity. So if there was some other possibility of a disease process, like your diabetes, for example, that has to be included, that this was considered and ruled out. Documentation that supports that the visual impairment is not correctable with a change in glasses or contact lenses. Again, a statement like that is also supportive of the medical necessity. Any other documentation that supports medical necessity. Now, the documentation must support the diagnosis code as well as the CPT codes that are billed. Again, right? You need both to match the surgical procedure. All documentation, again, this is going to vary by the payers, but for any of your MACs in the country, you need to include all of this information, the patient name and the date of service on each and every page of documentation. And of course, the documentation has to be legible and complete, including signatures. And finally, I focus Season 15 Spark on hopes and aspirations. I want this 15th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires us with their statements involving hopes and aspirations. So, in this week's inspiring quote in Spark is from Langston Hughes. Hold fast to dreams, for if dreams die, life is a broken-winged bird that cannot fly. Absolutely true, right? This quote reminds us to keep dreaming. This quote reminds us to never forget our dreams, even those we had in childhood. At all ages and all stages of life, it's important for us to soar, to know that our dreams can take us far. I'm happy Langston Hughes' spark still burns brightly and still inspires so very many. All right, you guys, that wraps up today's episode. Now, I really do hope you guys have an incredible month of June in store for you, because a lot of big moments, a lot of big warm days are coming up. So let me know if you guys are heading to the pool or heading to the ocean for a vacation. Let me know, because I will just be here working away. No vacations in sight for me, but I am enjoying my birthday month starting June 1st. So all 30 days, I will be celebrating my birthday, which happens to fall later in the month. But of course, when you get to be a certain age, you just enjoy celebrating each and every day. So that's what I'm doing. But anyways, you guys, I wish you all an incredible, incredible week ahead. Thank you guys so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.